Ever wondered what protein in your urine really means? Learn how this silent sign could be the key to protecting your kidneys and heart. Discover actionable steps that could save your health starting today. If your doctor recently told you that you have protein in your urine, you're probably wondering, should I be worried? What does this actually mean for my kidneys and my overall health? Well, today I'm going to answer these questions and give you the knowledge you need to take action. As a nephrologist, I see patients almost every day who are concerned about discovering protein in their urine. Many feel anxious, confused, or even scared. I want you to know that understanding this condition is the first step towards managing it effectively. In this comprehensive video, I'll explain exactly what proteinuria is, why it happens, how we detect it, what it means for your health, and most importantly, what you can do about it. Whether you're just diagnosed or you're trying to prevent kidney problems, this information will empower you to make better decisions about your health. As a board-certified nephrologist and obesity medicine specialist, I bring a unique perspective to kidney health. I'll be sharing evidence-based information drawn from the latest medical research, including the 2024 KD Gold Guidelines for Chronic Kidney Disease Management. Now, before we dive in, remember this video provides educational information only and does not replace personalized medical advice. Always consult with your healthcare provider about your specific situation. What is proteinuria? Let's start with the basics. Proteinuria simply means an abnormal amount of protein in the urine. Normally, your kidneys act as sophisticated filters, keeping valuable proteins in your bloodstream while removing waste. When proteins start appearing in your urine, it often signals that this filtering system is not working correctly. Now, there are several types of proteinuria to understand. First, there's what we call transient proteinuria, which is temporary and usually benign. It can happen due to fever, strenuous exercise, emotional stress, but it typically resolves on its own. Second is orthostatic proteinuria. This mostly affects adolescents and is characterized by protein in the urine when standing but not when lying down. This type is generally harmless. Third is the persistent proteinuria. This is what concerns us the most as it suggests ongoing kidney damage. This type requires medical management and proper attention. Alright, how do we measure protein in the urine? The most common methods are urine albumin to creatine ratio. This is the preferred testing for detecting albuminuria, especially in the early stages. Remember, albumin is one type of protein. It's a simple spot check that doesn't require 24-hour urine collection. Then there's the urine protein to creatine ratio that measures total protein rather than just albumin. The traditional 24-hour urine collection remains the reference standard, but it's not as convenient. Simple dipstick tests at your doctor's office can help with initial screening but require confirmation with more precise lab tests. So what is considered normal? Well, generally proteinuria is diagnosed when urine protein exceeds 150 milligrams per day. For the abdomen to creatine ratio, specifically less than 30 milligrams per gram is normal. 30 to 300 milligrams per gram indicates microalbuminuria, which is an early sign of kidney damage, and greater than 300 milligrams per gram signifies macroalbuminuria, suggesting more significant kidney problems. Now, these numbers matter because they help determine both the diagnosis and the treatment approaches. Why does proteinuria happen? The most common cause or the most common source of proteinuria is damage to the glomeruli. These are the kidneys' primary filtering units. Think of glomeruli as incredibly intricate sieves which have very precise openings. When these structures are damaged, they allow proteins to leak through and go through that barrier. Now, the conditions that cause this type of damage include things like diabetes. So in other words, diabetic kidney disease, which is the leading cause in adults. There are various forms of glomerulonephritis, which is inflammation of the glomeruli. There are autoimmune conditions like lupus nephritis, high blood pressure, or hypertensive kidney damage, and then of course there are genetic causes like Alport syndrome. Beyond the glomeruli though, damage can also occur in the kidney tubules. Normally, any small proteins that do pass through the glomeruli are ending up to be absorbed by the tubules. So then when the tubules are injured, this secondary reabsorption fails, and causes of tubular type of protein in the urine include acute tubular necrosis or ATN, tubular interstitial nephritis. Medications can do it. So, medication toxicity, and there are always certain genetic disorders that can cause both plumea and tubular proteinuria. Finally, there's a third major category, and this category is called overflow proteinuria. This happens when there's an excessive production of proteins in your bloodstream, so many that even healthy kidneys can't keep them from spilling into the urine. Now, some of these examples are multiple myeloma producing Benoni proteins. There's rhabdomyolysis, which is a breakdown of muscle releasing myoglobin, and then there's hemolysis releasing hemoglobin. To understand this visually, imagine your kidney's filtering system as a sophisticated coffee filter. Normally it keeps the coffee grounds in while letting the liquid, which is waste and water in this case, pass through it. In proteinuria, that filter becomes damaged or overwhelmed, and this allows those valuable proteins to leak through. Alright, so why does protein in the urine or proteinuria matter? Well, proteinuria isn't just a laboratory finding, it's one of the earliest and most important markers of kidney damage. Research consistently shows that high levels of proteinuria strongly predict faster progression to end-stage kidney disease. According to recent studies, a fourfold increase in albumin to creatinine ratio is associated with more than a 3 times higher risk of developing end-stage kidney disease. Then there's cardiovascular risk. Perhaps surprisingly, proteinuria is also a powerful predictive of heart events. The relationship between kidney and heart health is remarkably strong. Even mild increases in urine protein levels are independently associated with increased risk of heart attack, stroke, and death from cardiovascular causes. This connection exists even in people without diabetes or high blood pressure. Here's something crucial to understand. Proteinuria isn't just a sign of kidney damage. It actually contributes to further kidney damage. The proteins that leak into the kidney tubules are toxic to these structures, causing inflammation and scarring that progressively worsen kidney function. This creates this damaging cycle where more protein leakage leads to more kidney damage, which causes even more protein leakage. I want to emphasize that even microalbuminuria, small amounts of protein in the urine that wouldn't be detected by some of the older tests, significantly increases health risks. In patients with diabetes, microalbuminuria is associated with nearly twice the risk of all-cause mortality and cardiovascular death. This is why early detection and monitoring are so important. Now, I understand how concerning these risks might sound, but I want to reassure you that identifying proteinuria early gives us an incredibly valuable opportunity to intervene before any serious damage occurs. Knowledge truly is power when it comes to protecting your kidney health. Let's talk about signs and symptoms. In the early stages, proteinuria typically causes no noticeable symptoms. This is why routine screening is so important, especially if you have risk factors like diabetes, high blood pressure, excess weight, or a family history of kidney disease. As protein loss increases though, you might notice foamy or bubbly urine is often the earliest visible sign. This happens because protein changes the surface tension of urine. It's similar to how soap creates bubbles. Edema, swelling, particularly around the eyes in the morning or in the ankles and feet later in the day, is another sign. This occurs because proteins that normally help keep fluid in your bloodstream are being lost. This allows fluid to leak into surrounding tissues. With significant proteinuria, especially in kidney conditions like nephrotic syndrome, you might experience unexplained weight gain from fluid retention, fatigue and weakness, loss of appetite, and increased susceptibility to infections. However, it's important to remember that many people with protein, even at concerning levels, have no symptoms at all. When to see a doctor? You should see a doctor promptly if you notice persistent foamy urine, unexplained swelling, or if you have risk factors for kidney disease like diabetes or hypertension. Even without symptoms, regular checkups are important if you have these risk factors. Let's dive into the evaluation of proteinuria. When evaluating proteinuria, your healthcare provider will typically start with a detailed medical history, asking about symptoms. medications, recent illnesses, and risk factors for kidney disease. They'll do a physical examination, checking for signs like elevated blood pressure, swelling in the legs, and then of course they will order laboratory tests to confirm the presence of protein in your urine and evaluate your kidney function. Now the most common lab tests include a urinalysis to check for protein and other abnormalities, a urine albumin to creatinine ratio, and/or a urine protein to creatinine ratio. I always check both because albumin is one type and protein covers all the different types, so you don't want to miss, for example, overflow protein area according to the 2024 KDIGO guidelines. A urine albumin and urine protein to creatine ratio, along with the urinalysis, are the preferred initial tests. Now blood tests to measure kidney function include electrolytes, serum creatine, blood urea, nitrogen, and we calculate an estimated glomerular filtration rate from the measurement of blood creatine. Once we have these basics, then we may need to check for additional things that are linked to protein in the urine, such as diabetes, lupus, multiple myeloma, and so forth, and your doctor would tell you all about it. When it comes to imaging, a kidney ultrasound to evaluate kidney size and structure and check for obstruction or masses is then done. In some cases, imaging like CT scans or MRIs might be needed, but I always try to minimize any radiation to my patients by trying to do ultrasounds. Now, in certain situations, particularly when the cause isn't clear or when there's a whole lot of proteinuria that I can't explain and I see a decline in kidney function, I recommend doing a kidney biopsy. Now, this involves taking a small sample of kidney tissue from your kidney for microscopic examination to determine the exact cause of the protein leakage. Now once again, remember that evaluation should be personalized, should be based on your specific situation, including your age, other medical conditions, and the severity of protein. Not everyone will need every test. Alright, how about the treatment and management? The first principle of treating protein in the urine is addressing any underlying causes. For diabetic kidney diseases, optimizing blood sugar as absolutely critical. For hypertensive kidney damage, blood pressure control is paramount. For glomerulonephritis or lupus nephritis, immunosuppressive medications might be needed to calm down the disease. And then all the other conditions we've talked about so far, they all have their own targeted treatments. Now, several medications have been proven beneficial for reducing protein in the urine. ACE inhibitors and ARBs are cornerstones of therapies. Those are names like lisinoprolol, and they're especially for patients with albumin exceeding 300 milligrams per day. These medications, they reduce the pressure within the kidney filtering units and directly decrease protein leakage. Now, for patients with diabetes, SGLT2 inhibitors like Impagli, which is a brand name, is Jardian, have shown remarkable benefits in reducing protein in the urine and slowing kidney disease progression. And recent trials showed these medications, the SGLT2 inhibitors, can reduce the risk of kidney failure substantially. There's also GLP-1 medications, which we have talked about, that can also play a role in lowering the risk of kidney progression, including end-stage kidney disease, especially in patients with diabetes. Now, in some cases, statins are recommended, but they are not recommended specifically for addressing protein in the urine, but to reduce the associated cardiovascular risk because lipid levels markedly rise in proteinuria. But let's not forget lifestyle modifications beyond medications. There are several lifestyle changes you can make that make a significant difference. We've talked about sodium, and sodium restriction is particularly important. You want to limit sodium intake to less than 2.3 grams per day. This can reduce blood pressure and directly reduce protein in the urine by 30%. Another one is maintaining a healthy weight. This reduces the strain on your kidneys. Even modest weight loss can reduce your overall risk, significantly improve proteinuria, and overall delay the progression of kidney disease. Regular physical activity, any kind of activity. As you know, I talk about rowing a lot because it covers both strength training and cardiovascular training and hits over 80% of the muscle groups in your body. But any type of regular physical activity, walking, jogging, swimming, biking, and if you're trying to aim for standards, Standards are about 150 minutes of moderate exercise weekly, 30 minutes a day, 5 days a week. You got it. And then finally, is the diet. As you know, a diet that's rich in fruits, vegetables, whole grains. In other words, a plant-predominant diet that limits processed foods is vital for blood pressure and reduces overall inflammation. In terms of monitoring, remember ongoing monitoring is essential to track your progress. You need regular testing of urine protein levels to assess the response to treatment. Got to monitor that blood pressure because high blood pressure, hypertension and protein in the urine are closely linked. You need kidney function tests to ensure your kidney health is stable or improving. And the frequency of monitoring depends on the severity of your condition and the response to treatment. Now, I know that lifestyle changes can be hard, especially changing your diet. Just remember, start with small, sustainable changes rather than trying to transform everything all at once. Remember that even modest improvements can yield significant benefits for your kidney health. But most importantly, remember, learn to love yourself and know that you are worth it. Alright, let's summarize the key takeaways of what we've covered. Today, 1. Porphyria is an abnormal amount of protein in the urine and serves as an important marker of kidney health. Number 2, it comes in different types from temporary harmless forms to persistent protein that requires medical attention. Number 3, protein matters because it predicts kidney disease progression, cardiovascular risk, and actually contributes to ongoing kidney damage. Number 4, evaluation includes urine and blood tests, possibly imaging studies, and in some cases a kidney biopsy. And number 5, treatment involves addressing the underlying causes using medications like ACE inhibitors, ARBs, SGLT2 inhibitors, GLP-1s. Those are names like lisinopril, Lortin, empagliflozin, semaglutide, and it also involves lifestyle modifications, such as sodium restriction and maintaining a healthy weight. Now here are some practical takeaways. If you have risk factors for kidney disease, particularly diabetes or hypertension, ask your doctor about screening for and if you've been diagnosed with proteinuria, work closely with your healthcare team to understand the cause and develop a treatment plan that's individualized to you. Please be consistent with medications, especially the ACE inhibitors or ARB, which are proven to reduce protein in the urine and protect kidney function. It's always important lifestyle. Focus on sleep, focus on movement, focus on stress reduction, gratitude, kindness, meditation, yoga. Focus on a whole food plant predominant diet as much as possible, and make sure to keep all your follow-up appointments even if you feel well, cause remember, early protein and even middle and later stages sometimes have no symptoms. Now I want to leave you with an empowering. Porphyria is often one of the earliest detectable signs of kidney problems. Identifying it gives you the opportunity to take action before significant damage occurs. With proper management, many people with proteinuria can preserve their kidney function, even improve it, and live healthy, fulfilling lives. In my years of practice, I've seen countless patients successfully manage proteinuria and maintain good kidney health through a combination of medications, lifestyle changes, and regular monitoring. Your diagnosis is not a definitive forecast of your future kidney health. Your actions from this point forward matter tremendously. Thank you for taking the time to learn about this important aspect of your health. Knowledge truly is power when it comes to kidney care. Please share this video with anyone who might benefit from this information. Remember to practice kindness both towards others and towards yourself as you navigate your health journey. I'm Dr. Shan Hashmi and I'm here to support you every step of the way. If you found this video helpful, please hit that like button and subscribe button to stay updated on evidence-based kidney health information and general wellness. Check the description below for links related to videos and resources. Take care, all for your kidneys and they'll take care of. Conclusion: protein in your urine is not just a lab result, it's a powerful signal from your body. Recognizing it early offers an incredible chance to reverse damage and protect your future. Through informed decisions, personalized medical guidance, and sustainable lifestyle changes, you can take charge of your kidney health. Remember, your kidneys matter, and you have the power to protect them. Stay proactive, stay informed, and stay kind to your body.